I wanted to talk a little today about how we pay for hormone optimization. I've mentioned a lot on this channel how I know lots and lots of hormone optimization providers all over the US and some in Canada and the UK. I also have said that I have a lot of patients who are contacting me almost every single day asking where they can find a provider who can help them with their hormones, with hormone optimization. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy to understand patient education resources. Most of those are about hormone optimization. That's getting your hormones not too high, not too low, but just right. Sometimes I wonder if when a patient contacts me and I give them the name and number and address and website of a provider that I know will do an outstanding job at helping them optimize their hormones, well, sometimes I worry a tiny little bit that the patient's going to be upset with me when they find out that that provider that I recommended doesn't take their insurance. It's because a lot of the providers that I have relationships with don't take insurance. Some of them do, but the majority have chosen not to, and there's definitely a reason for that, which I'll explain in a bit. That seems like a deal breaker for many of us, if not most people, and I can totally understand. But what I want to do is help you as a patient understand a little bit more about this idea of paying cash for medical care, for health care specifically. It may seem like no way at first, but once you have a little bit more information, it might not seem as bad as all that. So let's talk about medical care in the United States. First of all, since the majority of my audience is American, my apologies to those in Canada or in the UK with national health. Your situation is slightly different. Well, everybody knows that the US healthcare system is pretty much broken. It's hugely expensive, terribly unfair, completely embedded with big pharma and big insurance. The costs are some of the biggest societal costs in the history of the world. Healthcare is just plain ridiculously expensive. A couple of things a lot of people fail to recognize about it. Number one, it's really not about healthcare. It's really more about sick care. And number two, the costs of healthcare are so exorbitant because so many of us are incredibly sick. So when I talk about sick care, I'm talking about a basic philosophy of mainstream medicine. Your primary care doc has most of the time been trained by no fault of his or her own to look for what's wrong with you. What are the diseases? If you have high cholesterol, your doctor wants to give you a statin to help lower your cholesterol and they think reduce your risk for heart disease. If you have high blood sugar, well, they might give you a drug called metformin. They might give you some advice about eating right and may tell you to lose weight and maybe try to eat less sugar. That metformin or some other medication is going to theoretically help lower your blood glucose. If you have osteoporosis or weakened bones, your doctor might prescribe a bisphosphonate, a drug that's supposed to slow down the progression of bone loss so that you don't break a hip. If you need to lose more than just a few pounds, maybe you're even overweight or obese, your doc might tell you to exercise more, maybe do some walking, and they'll say to eat less because everyone knows that calories in equals calories out. And if you have the willpower to do that math, then you'll lose weight, you'll be the same size you were at age 30 in no time at all, right? Well, the big problem with all this is that it simply doesn't work. We take statins for cholesterol and metformin for diabetes. We eat less and move more, and we take Fosamax for bone loss. But essentially, none of those treatments make that much of a difference. They might slow things down a little bit, but they don't do anything to keep us healthy. Just look around. Do you see people getting less sick? Do you see people taking 2, 3, 4, 6 medications every month? And it's making them feel hale and hearty, and all of a sudden they feel like they're 30 again? No way. They feel like absolute crap. And the more drugs they take, the worse they feel. The healthcare system in the US isn't about health. It's about sickness. And very little of what we're doing to treat that sickness is making all that much of a difference in any of our lives. We're fatter than we've ever been by a mile. Our blood sugars are higher than ever. The CDC says more than 84 million people ages 18 and older have prediabetes, also called insulin resistance in the United States. That's about 1 out of every 3 adults. We have more heart disease, more Alzheimer's disease, more osteoporosis, and more strokes than we've ever had before. The sick care system in this country is failing to halt the tide of sickness. To be fair, much of that sickness is caused by the way we eat, the ways we don't ever get off our butts and do any exercise, the terrible stuff we put into our bodies in the form of junk food and cigarette smoke, vaping, industrial seed oils and unhealthy trans fats, sugar, and whatever else. So here's what you need to understand about the health or sick care system in this country. The idea of chasing disease is completely baked into our healthcare. Here's what I mean. There's a system called ICD-10. That acronym ICD-10 stands for International Statistical Classification of Diseases and Related Health Problems, ICD. And it's the 10th version that we've come up with. By the way, we've been doing this coding system since 1993, almost 30 years. Anyway, the whole system of health insurance, including Medicare, is based on these codes, ICD-10 codes. The codes are designed to pinpoint the disease. What specifically is wrong with you? There are something like 14,000 different diagnosis codes, and even those have been expanded into variations. There's something like 70,000 altogether. And then there are thousands of other codes that pinpoint treatments or what are called procedures. So in other words, what procedures are we going to code to attempt to change the disease that we've coded you for? So our entire healthcare system is centered around these ICD-10 codes. If there's not a code for what you're feeling or experiencing, then it's not a covered problem. And if there's not a code for the treatment or a procedure, then it's not a covered solution. Ever felt like a number? Well, in some sense, you are a number. In fact, you're a bunch of ICD-10 codes that your doctor sends to your insurance company or to Medicare, and your health is managed using those codes. Your doctor has to deal with hundreds or even thousands of those ICD-10 codes every single day. In a typical family practice, they may have hired 1, 2, maybe even 3 people just to figure out what codes to bill for which patients at which time. It's not a full-time job, it's 2 or 3 full-time jobs. Well, I personally think ICD-10 could stand for something a little different. It could stand for insurance can decide. That's because when you rely on health insurance or Medicare, the health insurance company or Medicare is who is deciding almost everything about your health. Health insurance is sort of a necessary evil. It's necessary, but it's not always the best friend we may think it is. Have you ever struggled on hold for hours with your insurance company waiting for prior authorization? How about getting to a doctor's appointment and having the receptionist tell you, well, your insurance company is going to require a referral in order to cover this visit? That's happened to my wife a couple of times in the last year. Have you ever gotten to the pharmacy to pick up a prescription and the pharmacy tech tells you that the prescription isn't covered on your plan and it's going to be $300 without prior authorization? And don't even get me started on health insurance transparency. There is absolutely zero transparency for patients like you and me when it comes to health insurance. Well, my doctor, when I had health insurance, used to bill my health insurance, and they paid him something. And then I got an explanation of benefits in the mail, which for the life of me, I could not understand anything on it. There are premiums, there are copays, deductibles, donut holes, out-of-pocket maximums, lifetime maximums, and on and on and on. Well, I'm a healthcare professional and I don't understand what half of that stuff actually means. It's extremely confusing and it's not transparent at all. I think it's designed to not be transparent. What I've just described is sick care. It's all about getting the code as fast as you can and cranking as many patients as possible through that family practice clinic. But there are lots of other ways to approach healthcare, different models where individuals might pay their healthcare provider to keep them well, maybe cutting out the middleman, which is insurance or Medicare. And those may not be as expensive as you might first think. What if your healthcare was paid for more like your car insurance? So you have car insurance, right? I'm pretty sure it's required by all states. Your car insurance maybe costs you $100 a month, more or less, depending on if you drive a Tesla or a 2011 Honda Pilot like I do. Car insurance covers your car and any damage to any other people or cars if you get in an accident. What car insurance doesn't cover is tires or repairs or gas or oil changes. Those are just normal expenses that you take care of. It doesn't make sense to expect car insurance to cover every little expense when you can just pay for it directly and cut out the middleman. But health insurance is supposed to cover every healthcare expense, from hangnails to heart attacks to hormone replacement. There is a way to make health insurance a little more like car insurance, though. You can cut out the middleman. It's a healthcare model called direct primary care, or DPC. DPC is where the patient pays a monthly fee to their doctor or healthcare provider to keep them healthy. There's no billing codes, no ICD-10s, no prior authorizations, referrals, deductibles, no explanations of benefits, no donut holes or out-of-pocket maximums, and no lack of transparency. A DPC provider takes care of patients with a clear agreement up front. We both agree about what the doctor will and will not do for us. My good friend Carl Lambert, who runs Ready Medi Integrative Clinic in Wenatchee, Washington, he charges patients somewhere less than $100 a month for comprehensive health care. He doesn't have thousands of patients, so he can sit down and spend the time he needs to get to know his patients, each and every one of them. He gives his patients his cell phone number and says it's okay to text him if they have a concern or a question. He's available 24/7, and they can make an appointment to come into the clinic and see him usually within the next 24 hours or so. Well, many of the things my friend Carl brings to his patients don't have ICD-10 codes. They're not covered on insurance or Medicare, but none of that matters. Carl is caring for the health of his patients. He doesn't care about ICD-10 codes, and he doesn't hire anyone to do it for him. Carl's billing is just a credit card, automatically charged every month. That's it. Carl's keeping his patients' hormones at optimal levels, which also isn't covered on insurance generally. He's preventing insulin resistance and diabetes. He's helping patients eat in ways that improve their health and guiding their lifestyle and exercise habits with health coaches and supplements. He's even reaching out to local employers and helping them keep their employees healthy. It doesn't have anything to do with insurance. None of that is covered on insurance, and it doesn't matter. Carl's patients are all paying less than $100 a month. Just about anybody with an income can afford $100 a month. That's about what most people pay for their cell phone bill, or maybe their car insurance. Go ahead, try to get traditional health insurance for $100 a month. Good luck with that. Now, to be fair, a person subscribing to a DPC provider will most likely need a major medical insurance that covers like catastrophic medical expenses, but that's nowhere near as expensive as regular health insurance might be. Do you have any idea what it's like to be a physician in this country? How about specifically a family practice doc? Well, I've seen a bunch of surveys that indicate that 50 to 55% of doctors want to quit their jobs in the next 5 years. They're stressed, overworked, overwhelmed, and exhausted. There's kind of a basic rule of thumb that a doctor can reasonably care for around 1,000 patients, except for a lot of family practice docs would laugh at that because many of them have 2,500 patients apiece. That means quite literally that a family practice doc especially can see patients for maybe 13 to 16 minutes at a time. Sit down with a doctor, or anybody for that matter, for 16 minutes and see what you can accomplish. You might catch their name, but spending that little time with a patient helps the patient with absolutely nothing. Some doctors are better at it than others, but it is a real handicap. Doctors often hate their jobs. They're completely burned out. And get this, doctors kill themselves at about the same rate as combat veterans do. Practicing medicine causes that much PTSD. Well, what if your doctor was allowed to treat the patient as a human being? What if your doctor wasn't so incredibly stressed out and overworked and overwhelmed all the time? What if your doctor didn't have to spend just 13 to 16 minutes per visit with 2,500 patients, but they had the time to spend maybe 30 minutes, maybe 45, maybe even an hour with each patient? What if your doctor only had 1,000 patients, or maybe 600 to 800 like my friend Carl has, and that doctor could spend the time necessary to really understand you and what's going on with you and your husband and your wife and your family? What if you could experience something beyond those ICD-10 codes that somebody puts into a computer making you a number? What if your doctor spent some real face-to-face time with you and wasn't staring into a screen for 13 minutes and then ripping off a prescription and saying, "Next"? Remember, it's not her fault. It's the sick care system. There are other medical practice models in addition to the direct primary care or DPC model. Many of the hormone optimization providers I know and recommend use some sort of membership model. They might charge a yearly fee somewhere between $500 and $2,500 a year. They vary all over the place, maybe more, maybe less. But that yearly fee gives patients access to a bunch of membership benefits. They might or might not include the lab work. They usually include some type of yearly evaluation of your overall health, things like your risk factors, your lab results, going over your hormone levels, key health indicators, cholesterol, inflammation markers, your blood glucose, your insulin, your hemoglobin A1C. That's a long-term blood glucose measurement. If you're wise, you won't just instantly dismiss a healthcare provider just because they don't take insurance. What you really need to do is do a complete calculation that takes into account all the numbers and all the factors. You need to calculate the sense of being cared for and feeling like your provider cares. How much is that worth? You need to consider the added benefits of being able to get in touch with your provider directly sometimes through a call or a text message, or where they'll call you back in a reasonable amount of time to answer your questions or address any concerns or fears you might have. You might also consider the time you wait in the waiting room of a too busy family practice, all the insurance forms that you fill out, and all the frustration of things that are not covered for this reason or that. The main thing I'm trying to get you to recognize here is that whether we're looking at a provider who takes your insurance or one who doesn't and charges a fee, there are costs either way. So I would strongly recommend that you take a close look at all those costs, both the financial costs and in terms of hassles and red tape, when you make a decision about your health and wellness. Think of it this way: if you were looking for a doctor to take care of a sick child, you probably wouldn't just look for the cheapest doctor out there, would you? No, you'd look for the doctor that knows their stuff and who has a reputation that they can really help you and your family in your particular situation and make you feel cared for and make you actually better. Your health is way too valuable to simply look for the cheapest option. Well, I recognize that not all of us have the means to go to just any doctor and pay any fee they ask for or any price. But at the same time, we do have a choice and we do have options. Some of those options are surprisingly affordable. If you're a patient looking for help with your hormones, whether you're a woman in menopause, a man with low testosterone, a patient with thyroid issues, a woman in PCOS, or somebody worried about your long-term health risks like Alzheimer's and diabetes, well, I might be able to help you find a provider who really knows what they're doing, somebody who can help you optimize your hormones and transform your life. Click the link that says Find a Provider, and I'll see what I can do for you. If you're a hormone optimization provider, just be aware that I get referral requests almost every single day from patients looking for providers just like you. Click the link that says Get More Patients and join my provider database. I'll do my best to rustle up some referrals and act as a sort of matchmaker, helping patients in need find providers who can help. Hey, I also wanted to let you know that I've got a playlist that I've put at the end of this video with various, mostly physicians, talking about direct primary care and some of the other cash pay medical business models. So take a look at that playlist and watch some of those videos if you get a chance. If this video's been helpful at all, click the like and subscribe buttons to get notified whenever I post a new one. Thank you so much for watching, and I'll look forward to talking to you again soon.